Hi, and welcome to Gridlock.
I'm Teresa Chan, and I'm an assistant professor at McMaster University, and I have been working as the senior game designer and team lead for the Gridlock team.
And I'm Sam Lambert, a first-year medical student and part of the marketing team for Gridlocked. We will be giving you the Quickstart guide so you can start enjoying the game.
First of all, we'd like to thank all the various creators and the McMaster Division of Emergency Medicine for their support on the game development of Gridlocked.
In Gridlocked, there are healthcare providers and patients. The various healthcare providers include doctors, residents, nurses, radiologists, and consultants. Throughout the game, you will also encounter patients who need to be treated. There are 5 different types of patients. CTAS 1 patients who are the sickest, CTAS 2 patients who are less sick but still urgent, and CTAS 3, 4, and 5 patients who have less acute issues.
The goal of Gridlocked is to take care of as many patients as possible. To accomplish this, there are 3 sub-goals which must be completed. First, you have to survive your 8-hour shift. Second, you will try to maximize your points with a target of 500. Lastly, we want you to keep patients safe. We've built a patient safety meter to help you keep track of any patient safety events that may happen throughout the game. At the beginning of the game, you will start at the beginning of the meter and move up 1 spot for any adverse event. Be careful, as you only have 3 strikes before you're out.
To accumulate points in the game, you will need to treat patients. For each patient of different CTAS level, you are awarded varying amounts of points for discharging or admitting them. With your points, you can also purchase upgrades to your emergency department. Upgrades include hiring more staff, for instance, extra doctors or nurses, and purchasing more bed space.
So, what is a gridlock? In some emergency departments, being gridlocked means there are no more beds to see patients. This can happen due to many factors, including bed block in other parts of the hospital, or not promptly discharging or admitting patients.
In the board game, gridlock can happen in 3 ways. The first way you can gridlock is by not being able to place a CTAS 1 patient in the resuscitation zone.
Second, you can gridlock if all the rooms in your department, as well as the waiting room, get filled with CTAS 2s, 3s, 4s, and 5s. You have up to 10 spots in the waiting room if the step-down zone, intermediate zone, and minor zone are filled.
Lastly, if you fail to stabilize a CTAS 1 or CTAS 2 patient in time. Let's talk about this a little more. CTAS 1 and 2 patients require you to stabilize them almost immediately. In real life, these patients are often very sick and need prompt medical attention. In Gridlocked, you must complete the tasks on the patient card in order to stabilize each patient. For most CTAS 1 patients, you will have 2 turns to complete the tasks, and for most CTAS 2 patients, you will have 4 turns. Every subsequent turn for which your patient is not stable, you will check off one of the turn boxes. Once the patient is stable, you can check off the patient with an S.
Now that we've explained the premise of Gridlock, let's set up and play. This is the play board. On the board, we have the resuscitation zone, the step-down zone, the intermediate zone, and the minor zone. We also have a waiting room with 10 additional spaces for all the CTAS 2 to 5 patients. Each zone is color-coded for each patient card. Patients can be moved around within the department. For example, CTAS 5 patients from the minor zone can be moved to the intermediate zone, and a stable CTAS 2 patient can be moved from the step-down zone to the intermediate zone. Be mindful that when stepping down patients, you can only move them down once they've been stabilized, and can only move them down 1 acuity level. So for example, 1s become 2s, 2s become 3s, etc. The next part of the board is the turn counter, and this is how you keep track of what turn you're on within your 8-hour shift. Each turn represents 1 hour. There is also the deck slot, the discharge slot, and the admission slot, and the dreaded patient safety meter.
As you move up in turns, you will notice the number of patients you draw will increase as indicated here. On some turns, you will also notice a die, which indicates you will have to roll to draw additional patients.
So just to review the patient safety meter once again, for each adverse event in the game, you will move up 1 space on the meter. Adverse events include not being able to place a CTAS 1 patient, filling up the department and the waiting room, and not stabilizing a patient in time. You will notice that points will be subtracted from your total score if you have one of these adverse events.
And now, shuffle and place the deck of cards face down on the patient deck slot. draw 10 patient cards. If you draw an event card during initial setup, reshuffle them into the deck. We will touch on event cards in a minute.
And now, because it's your first turn, you will have to draw another 3 additional cards. You may, at this point, draw an event card. Event cards add an element of chance, either serving to help or to hinder you in the game. There are positive event cards, which may give you extra actions during some of your turns, or there may be negative event cards which disrupt your department.
Now, let's move on to the action phase. Remember, your initial ED team consists of playable characters including a doctor, a resident, 4 nurses, a radiologist, and a consultant. You may notice an extra doctor and nurse card included in the game. These are only available after accumulating and spending enough points. Each character has an associated action card. Each character has a different number of actions they can use each turn. As you treat and manage patients by completing tasks, you will check off actions on the respective cards. Each character in the game can move and treat patients, which both cost 1 action each. Next, we will highlight some specifics about each character.
The staff doctor can complete a doc task in any zone. Residents are in training, therefore they have some restrictions on the kind of patients they can treat. They can do doc actions in every zone independently, except in the resuscitation zone. If the staff doctor is also in the resuscitation zone, they can proceed to treat the patients there.
Nurses can move patients between zones and from the waiting room. But remember, moving patients costs 1 action. So, how do we treat patients? Let's meet Veronica, a 59-year-old female who has various tasks that need to be completed for her to be treated. There are actions that need to be done in sequential order by the various healthcare professionals in the department. Each action must be done in order.
The actions within one block can be done in any order, but each block must be completed before moving on to the next. So for instance, all the actions in block 1, vital signs, ECG, oxygen, and assessment by the doctor, must be done before moving on to block 2, which contains the chest x-ray and the blood work.
Based on the cards you've drawn, place them on the board. And now you are ready to deploy your team around the department to treat all of these patients.
After you have used up all the action points for your team, you are ready to end your turn. In the end of turn phase, you will update your total points. Remember, if needed, you can upgrade your department. You will also clear patients who can be discharged or admitted. And lastly, you will update the patient stability meter on CTAS 1 and 2 patients.
On subsequent turns, move up the time counter by 1, draw new cards, and roll the die if needed. You should also be moving patients up from the waiting room at the start of each new turn after drawing new cards.
As a reminder, you want to try to attain 500 points to win the game while minimizing your adverse patient safety events throughout the game.
So to recap, in Gridlocked, you have 8 turns to accomplish your 3 goals. At the end of the game, you will total up your points and make deductions for any adverse events, upgrades, and any remaining unstable CTAS 1 or 2 patients, which cost you 10 points per patient. Now that you've been introduced to Gridlocked, you're ready to play. Please enjoy your shift.